Is it working? Yeah, it's working. Thank you. So as people trickle in, it's fine. I know people are leaving and everything. So if you need to put your suitcases here or whatever, I'm blessed that you are here. I'm very pleased. Thank you. I put this together because not everything we see is IVDD. I mean, we see a ton of that, like 90, 85% that walks in our door of our neuro cases tend to be IVDD. So not everything is IVDD. Here, he was my own boy. He's a Welsh Springer. It was a Welsh Springer Spaniel Golden Retriever mix. Of course, the Golden Retriever. Out of this litter, we had 6 puppies. 5 of them look like Golden Retrievers. 1 Hart, who I kept, looked like the Welsh, and I had the Welsh. All the Golden Retrievers died of cancer 10, 11, okay, including Lennon, and because he was alive for a while after this. And Hart did finally die of cancer, probably hemangiosarcoma, pericardium, heart. She was 14, and her daddy died of dementia. I had to put him down at 15, the Welsh. So I'm like, oh, Golden Retrievers. I love them, but it's so hard to have these guys die so early. I had a whole family of hemangiosarcoma Golden Retrievers. Even vigilant, watching them, ultrasound in her. Damn, didn't she die from the took it out, it was in her liver. So she lived a couple months. So even with good care, we cannot get over that stupid genetics. So he came in, really bad pain. He had delayed CP, delayed motor. His lab work I thought was normal. His radiographs suggested some spondylosis. He was a ball player, a swimmer, very, very, very active dog. Ball, Golden Retriever. So he would run and play every day. His radiographs. So I started my normal acupuncture. I adjusted him. We did a little massage, started him on some herbs. He definitely responded to the treatment pretty quickly. Then in October, so that was August, in October, severe pain, CP, motor, and we started him on a little bit of pred. And here is my rule for myself. If after 3 sessions of acupuncture and my normal work, if they do not respond, something else is going on. Usually, we know how these patients usually get. And if they don't respond, I start to look elsewhere. What else am I missing? What do I need to do? So, come on, behave. So sent out the blood on October. Kind of unremarkable except for the globulins, which were 4.9. Excuse me. And the monocytes. So I'm like, he's hurting and things are going on. But in retrospect, when I see this and the increased globulins with his symptoms, I should have been much more aware of a syndrome and a cancer called multiple myeloma. It is a malignant plasma cell production. And what you see is you see the IgM, IgA, and IG, actually IG start to come up. So we got him up to North Georgia, and we saw 3 lytic areas. Multilytic areas, T6, L1, L6. So they thought it was osteosarcoma and that he had a spinal cord compression at L1. Let me get a cough drop. That's why he went down. So of course they call me and they asked me, do we want to put him down? Because it could be osteosarcoma. I'm like, it's not osteosarcoma. I didn't think it was. I said, no, let's do the surgery. So we went ahead and we decompressed him. Are you just turning on your own? Okay. It has a mind of its own. So we went ahead and we decompressed him. I tried to show there was a clot on his spinal cord from the lytic area. See? It likes to do it on its own. Okay. And it put a lot of pressure on his spinal cord, so that's why he went down. So we went ahead and decompressed him, took the samples in, and lo and behold, it was multiple myeloma. So I had areas of stasis, definitely kidney chi stagnation with deficiency, this type of stuff in that area. So we went ahead, of course, and we treated him. We did hemilaminectomy, post-op acupuncture herbal support, see? And is it on automatic? And we went ahead and did all this. His globulins got better. And then this is the drug that they use now for multiple myeloma. And we were able to keep him alive and feeling good for quite a few years with this. And it's a pulse therapy, along with everything else that I do. So lo and behold, Tilghman, Titan, really nice guy. So Titan, let's see, because he came in and he had some neck pain, he's had some cervical pain, and this type of stuff. He even had a little bit of digestive, gastric symptoms. He had been a rescue, but we know that these guys are prone to wobblers and cervical instability. I mean, it's just, it is a problem in this breed. So I really didn't pay attention, but when I finally got them to go on MRI, we had pathological fractures of L3, T3, T5. Some of these had been healed. And then we had the compression at C7, and this is the reason that he went down. And they went ahead and euthanized him because he had had such bad pathological fractures of his vertebrae. Now, he was a guy that had responded to acupuncture, did really well, responded to acupuncture, but I think when the lysis finally caused that pathological fracture is when he went down. So I went back. Elevated 3.9. So 3, I think on this scale I should have put 3 is the normal. 3.9, here, 4.6, 7, 8.6, and then down in here, 13.9 with anemia. This is what I should have picked up. Shoulda, woulda, coulda. That's why I put it up here. And this is where I think it's important that we get good diagnostics with this. She was an ER doc, an MD. So it was, once I was able to get her to go, then she totally understood what was going on. But when we, usually we look at globulins and go, oh, inflammation. But in these guys that you're not getting the response, they're really having a hard time, and I start to look at this, then this is where I start to key into the multiple myeloma. And if it's not pathologically fractured, then there are definitely treatment protocols that we can use with the oncologist to help them and live a long time. People live with this a long, long time. I think there's some new immunological treatments out for it that I've seen in the literature, which is great because this is much more common than we see, but I think if we start to look for it, we're going to start to see it. But this is where you see it, is in these globulins. Has anyone else dealt with this? What was your experience?
Well, my own personal doctor, but we found a punctate lesion on the dorsal spinous process, and we only radiographed him in my second year of med school because I listened to a heart down a murmur. But the globulins get elevated, but I've always seen them go faster. And then I'll just run a gel electrophoresis and find a single monoclonal peak.
Did you guys all hear that? Okay. How about you?
Two dogs, and for better or worse, they've been diagnosed with it. They came in for cancer, herbal therapy, and pain management. And luckily, I got 2 years out of them, and then they, eventually got
right? And that's, definitely, I mean, Lennon, I think, lived 3 years. But then herbal therapy, acupuncture, he got the best care because, of course, he's our dog. But this is something that when you have stuff that is a little weird and you start to see the globulins go up, I definitely do the electrophoresis that you can send in. This was all, post-mortem type stuff that we did and going back and looking at it. But it's something that I definitely think is out there, and we probably are missing it. So when those globulins and you start to see them go up and up, I'm like, mm-hmm. Any other comments about, yes?
Talking about that, I had a patient we've been treating PD for like 5 years. Originally it was TB zone lymphoma and was doing great, and then he had some weird issues going on, and oncology re-diagnosed him with multiple myeloma. But he didn't really have the pain, but he also was diabetic. He had cataracts. Just this whole slew of things, but like, he's still going. And she was going to euthanize him like 4 or 5 months ago, and we're like, wait, let's just do one more treatment. And then he turned around, and he comes and sees us once a month because he lives so far away. It's crazy.
So and I have a cancer dog for the next thing. If we get them to live 2 or 3 years with a really bad diagnosis, and many times I've had it, like in my bladder cancer dogs, they die of something else. With their cancer, we've done a good job. We've got to look at it that way because of their lifespan too. So here we did chiropractic, electro, dietary therapy, Chinese herbs. Definitely had a good life. Miss Frey's parents are Jamaican. They're adorable. I love them. And they, in fact, some of my cough drops came from her. And it was funny because they cook for him. It was good, but I'm like, he can't be a vegetarian. He has to have meat. But they were really good people, and how good they took care of him. So here you go. To DM or not to DM? That's a question, right? How many of you guys deal with DM? Yep. How many of you guys are sure that's the diagnosis? Sometimes and sometimes not. So,
Treated a couple with post-mortem.
Post-mortem. Atlas, he is a 13-year-old German Shepherd. Where's his video? Is this his video? Yeah, here. No CP, no motor. This is just the other day when he was in. Incontinence. Great people. They love him to death. He's a good man. Atlas is a good man. I got to say that. So, comes in, diagnosis here. He's a carrier. The CT at North Georgia found some minimal compression and possible of foramen stenosis at L7S1. The neurologist, MRI, 2 of them, I have spondylosis, but I have no spinal stenosis. Okay? So I have a carrier, I've got this, and clinically, he is progressively losing neuro in the rear legs, as you saw. Still has deep pain, but is losing his reflexes. Do I have stenosis? Do I have DM? He has not, we've lost the rear end. On some of my DM guys that have lived a long time, and I wish they had not let them, I've actually had them paralyze their diaphragm. And that definitely DM. Now, he is weird because I will electrostim him. I'll do a tail tip. I'll do the GV points into the tail tip, into, I call him Bei Feng, Lu Feng, on the top right here, kidney 1, stomach 36. So I'll do these points. And sometimes after I treat him, he kicks. He'll kick in the underwater treadmill. He will kick. He will get some reflexes going, but then we'll lose them. So he is not my typical DM dog. But what I'm going to do, I'm going to just keep on doing as long as his parents want to keep him. My big thing is this, bladder care. All these quadriplegic, paraplegic dogs, this is what gets them. For you older guys, remember Christopher Reeve, Superman? He was a quadriplegic, paraplegic. What happened is he died from sepsis from a bladder infection. So these are the guys that have those chronic bladder infections. And I'm always doing a culture and sensitivity. And of course, he had resistant bacteria, crazy resistant bacteria. So I went and I punted here. The nitrofurantoin, it's a nasty kind of drug, but it's a urinary antiseptic. And it helps me keep his, and I just had to put him back on Clavicin, or Clavamox, because he wears a belly band. Urine is the best bacterial media there is, and it is just a booger. So the crystal stone, it's a jing tong herb, is one that I use quite a bit. It's got gernaria in it, and that to help keep his bladder as healthy as possible. Because honestly, I think it's going to be his bladder that gets him, because when these guys get a bladder infection, you can't see it except they don't feel good. Dementia humans, my mom, Alzheimer's dementia, UTIs, they'll be doing good, they get a UTI, vroom. All these dementia symptoms get really bad. This is in dogs too. And my older dogs that are kind of, you got them good, and they go, check their urine. Because lo and behold, they won't have the typical urinary signs. But these guys, especially these paraplegic, quadriplegic dogs, get really bad fulminating bladder infections. And you think about it, it's urine, best bacterial media in the world. So with him, we keep going until they're ready. He's happy, he's eating, he's got all the quality of life, he's got a card at home, so he's able to be happy. But there may be a time, and there's Atlas and his family. Okay, DM or not DM, Woodrow just came to me last week or so before I came. So he'd been at Georgia, diagnosed with DM with an MRI at the Georgia Vet School. Okay, Woodrow is a baby. I don't even think they checked him genetically for DM. So what I found with him is when I put my hands on him, his neuro wasn't bad. He had some CP, little CP here and there. But what is happening with him, it's his blasted stifles. So he's got luxating patellas, and his stifles wobble. Doesn't have a muscle. That's why the underwater treadmill and everything's happening. So if I have my foundation wobbling, what's going to happen up my spine? It's going to wobble. This guy definitely had quite a bit of chiropractic work, needed definitely to be adjusted, electroacupuncture. Within the first treatment and adjustment, he's walking out the door. So now I'm working on his stifles. But he came in with a DM diagnosis. But what was weird for me, yes, corgis are on the list. Well, I have another slide about corgis are on the list. He was too young. He had pain. He was not my classic DM. I think because DM is such a default diagnosis that they go to it all the time. So I have to, when they come in, and Dr. Kara, who does PT with me, goes, yeah, doc, it's a loving touch special. It's just a loving touch special rather than putting it in a category. We'll work on him, we'll help them. But I think we're starting to see DM being diagnosed quite a bit. Do you guys see that in your practices? Yeah. Here is Kate. She started in 2015, definitely with problems with her hind limbs. This is a big thing, not painful. Woodrow was painful. I had put a muzzle on that corgi, of course. But they're not painful. I think I'm always looking to see if they're painful or they're not painful. Her diagnosis was IVDD, and she's a fox terrier, Wood. So of course I started everything that I usually do. She had been exposed, gong myling and jade windscreen, It's when that influenza was going around. So those are my Chinese herb go-tos for viruses. And we monitor progress, and she was continuing decline with her neuros. So further research shows that wire hair fox terriers are very vulnerable to this genetic mutation. We ordered the test, and of course it was positive. So the interesting thing about wire hair fox terriers, they genetically carry the defect for DM, but they don't show it as much as some of the other dogs because I think they're just so mean and tough. Like, I'm not going to go down. You know, Kate would. I'm not going to go down. I'm going to be here. And she really, really was here. So if we're going to do TCM, we definitely have a kidney gene deficiency and all the stagnation in the cord blocking it. So here's her affected at risk. This comes out of Missouri. I don't know, everyone knows that they have, Missouri has the testing that you send in. Thank God for Missouri now. And so what we did, Margie retired. Oh, she'd be happy to know her picture's up here. So she was fabulous working with Kate. Physiotherapy, underwater treadmill, all are normal. Happily, definitely went to a wheel cart and was very, very happy. But as these guys do, kidney yin deficiency, qi deficiency, in Chinese medicine, that Wei syndrome. She just withered away. And we definitely euthanized her 3 years after her diagnosis. So can we fix it? No. Can we keep them happy for a long time? Yes. How many of you guys treat DM? Okay. And I think the best thing, too, is the communication to the owner. I'm always telling Atlas's family, I can't tell you what he has, but I'm going to work on him. Yes, ma'am. Stand up so we can hear you.
One is Ozo, and if it's a male dog, it's pretty easy. Ozo gel, that's and especially if you're just not doing it all the time, but if you have it, and just put the Ozo gel wherever it's dry. And number two, Evergreen Herbs makes an herbal ABX, they call it, and it's an herbal antibiotic, and I've had several dogs, including my own, that I just kept on that so that there was less likelihood, instead of using an antibiotic or holding it,
Right.
using herbal ABX.
That's like the crystal stone I found is probably, that's got Drenaria, probably it's got like Coptis and Scoot and some of the antibacterial herbs. So ozone, great idea. I don't have an ozone. That may be a really good place to use ozone in that bladder. Definitely oxygen. Why not? Good idea. Thank you. So the wire hair fox terrier, I should have been keyed in, but also the fact that 65 breeds in a 2014 study on degenerative myelopathy have some of this defect. So, you know, we're seeing all sorts of crosses now. 115 breeds, all sizes, all types of breeds, and they've been reported. So the interesting thing is now we have Doodleville, right? And I'm like, oh my. I hope that they take after the standard poodle tends to be a little bit stronger than the golden retriever, or I've seen all these doodles. Burner doodles, okay. Cava doodles. It goes on, right? And you're like, oh. And they pay more for these blasted dogs than they do the purebred dogs. And I'm like, really? Well, I hope you like your veterinarian. So I know that Missouri is very interested in getting information so that they can do much more of studies with DM. Fiona, I loved her. She was the best girl. 2015, her gait was funny. So circumduction of the right hind, some CP deficits, didn't find anything. Like some of the sight hounds, she's definitely was metal. I like you. You know, she definitely had a little bit of a metal personality. So normal treatment, acupuncture adjustment, herbal support. So I followed up. She came back in, and we're a little bit concerned because the CP hadn't gotten better, and on her right hind. Okay, play, please. There. See the big mat I have? Ah, Dawn's there. Hello, Dawn. Here coming in, so that my dogs that come in through the front door can't slip on the tile. It's gym flooring. You can tell she's not walking well. And the photographer is really bad. Kind of stilted, ataxic. Dog really liked to run and play. He has wolfhounds. Okay, well, you changed on your own. So, February 25th, no improvement. We went ahead and went to the veterinary surgeon for a neuro exam. Dr. Corse, good guy, does great knees. Stiff, broad base, uncoordinated gait. CP being absent was getting worse, consistent with progressive. They talked about a T3 to TL myelopathy. And we went ahead to Georgia. So at Georgia, MRI. So we have an expansion of the subarachnoid space from T12 to L2. So this area is a dilation of the central canal along the thoracolumbar spinal cord. So the articulations between 10 and 11 were malformed also. So this is probably congenital. We're going to see this in another breed that's very popular. And this is called a subarachnoid diverticulum where CSF is accumulating. And it was keep putting the pressure on the spinal cord. Elevated protein in the CSF, but there was no inflammation. So we went ahead, we did this, okay, they can be congenital, and kidney Jing deficiency. Here's the diverticulum up here. So Fiona's case, they went ahead and tried steroids. And it helped decrease, of course, with some omeprazole to help the CSF production. I think omeprazole is supposed to reduce CSF. A hemilaminectomy was performed, and she went back to Georgia. So in May, they did another here, and they did this was before, and then they went ahead and they removed a bunch of the covering of the spinal cord, and they was allowed to drain. So 3 weeks, we started to work. She progressively improved. She did really, really well until here, 6 months. So, of course, we had tummy stuff. Here's Fiona with her little harness. Help me up harnesses are lifesavers. She's still a little tilted. She doesn't have CP deficits. She did pretty well. She still circumducts that leg. And she's still wide-based. So by the end of 16, she started to regress. Weakness, proprioception. They talk about it was likely a reaccumulation of fluid. She gave up. She was going down again. I don't think she was a very smart dog. Did not want to go through surgery again. Her shin was declining, and we kept her as comfortable as possible. Here we are in April. We went ahead and euthanized her about a year after surgery. Now, what I'm learning about these things is these guys, arachnoid diverticulum of brachiocephalic breeds. We start to look for them, and guess what? We find them. This is Joey. This is our PT center. Come on, little bowling ball. He's a little bowling ball. He's such a good, and you can tell COVID pictures. Everyone has masks on. Going through this, I went, oh, that's during COVID. So he's on Pred, 5 milligrams with some gabapentin. That's what they started him on. Started physical therapy, underwater, treadmill exercises. He continued 6 months, stopped, and now they're doing stuff at home. So what we have found on him is he had a subarachnoid space dilation, T4, T5, the arachnoid diverticulum, starting to put pressure again. So here you go. Medical management is guarded to fair to long term. A third will progress with medical management. A third will stabilize with medical management, and a third will improve with medical management. Surgical drainage and decompression has a better prognosis of 70 to 80%, and of course the treatment is steroids. So acupuncture, I haven't been able to do Joey in a little while. His mom's in the film industry. She does all the extras for Black Panther and all that type of stuff. But this is what we're going to see. We're going to see these guys. I've had 3, French Bulldog, the Wolfhound, and Pug, and another Pug. And the more that these French Bulldogs become very popular, the more that we're going to see. So if your acupuncture is not working, and it's helping, but you still got some CP, we still got some stuff going on, this is something that we need to look at. And Joey's still alive. I mean, we're probably, Tammy sending me these pictures said, I think we're going to get him a cart. They didn't want to do surgery on him. He's a little bit older. And surgery is, even though they say 70, 80%, Fiona lived a year after surgery. Has anybody else had this type of case come in that you know of? Yes?
So it's actually a vet colleague's dog.
So this is, you know, my 3 thing. If I work on him 3 times and I don't get a lot of change, I'm like, what else am I doing? What else is going on here? And the more that we see these guys, the more we're gonna be seeing this, because unfortunately you start x-raying these Frenchies, and you can see how crunched, how we have hemivertebrae. You're going to see it even in the healthy Frenchies. I'm starting to be on the lookout for it. And this girl, she's a Frenchie rescue. She's a year old. Her name is Riley. It was Izzy. You can see they're pretty crunched up in here. What she had, she was a rescue. Her colon wasn't attached to her anus, and she had hind limb weakness. So they went ahead and they reattached it. So she came to me to get her anal tone back so she could poop and not just have it just fall out. Plus she had a lot of weakness in her hind limb. If you think about the whole deal, and she's only a baby, and she's crazy. She will jump. I mean, she's a crazy Frenchie, and she's not nice to other dogs. So doing this, especially the dry needling, my GV, CV points, GV1, CV1, doing that whole rear end, trying to get everything to come back, to get her sphincter. She definitely, now she's able to poop on her own. And she's always going to have a little bit of deficit. But this is the type of thing, especially with Frenchies, that we're going to see all the time. So what I have learned when I'm going through all this is I always think about the breed and my breed crosses. So when I'm looking at my DM dogs list, Fox Terriers, Boxers, Welsh Corgis, Those are kind of the top guys. I've seen quite a few boxer DMs, and what I find about the boxers compared, like the Fox Terriers, and compared to the Corgis, is they give up faster. Boxers are soft, and I think the Terrier part, that woody part, I'm not giving up, you know, I'm a tough, it keeps them going. So my boxers, my German Shepherds, it depends upon their temperament to try to keep them going and to keep them up, and also, of course, family. So when we're looking at that, you know, you have to know your breeds. We once had a border collie we were spaying, and she started to have seizures after the pre-meds. We're working on intubating her. And I'm like, what's this about? Ding, she's Australian Shepherd cross. But it was border collie on the thing. She had the mutation. We reversed her, yeah, Reaper next, I think it was. We reversed her and she was fine, but I'm like, duh. You know, it's like, ugh, I should have known that. So you have to ask. Even I tend to ask DNA. Did you do your DNA, dog? Sometimes it's hysterical. You're like, really? And other times it's quite valuable because we know then about mutations. And if your usual treatment doesn't work, get help. I am very fortunate in my area that the surgeons work with me. They refer people to me. The neurology's great, where I can get these MRIs. It is a little bit pricey, but it is definitely something that I like to have, because all these cases, I wouldn't have known what happened without good diagnostics. I think from the time I've been in school in the dark ages to now, you laugh. It was the dark ages, wasn't it? We didn't have ultrasound, and we didn't have radiographs, you know, beautiful digital, the digital radiographs. We didn't have all these tools. So now we have them, and we're able to use them quite well. So I definitely will go to that. My epileptic dogs, can we get an MRI? And they're still epileptics. I have some really bad epileptics. And a couple of them are, I think it's mother-son breeding epileptic. Really a problem. So even though it used to be we had an adverse thing when it came to other practitioners, now they're more than happy to work with us. So what I want to do, we have a few more minutes, so I'm going to come down and we'll talk about some of your neuro cases and questions. So who has worked on a lot of DM? Yeah. What is your go-to? We'll start here. What is your go-to for DM? Acupuncture rehab.
I do electro. I try to do immunomodulation a little bit with the thymus extract, but I don't.
Hi, sweetheart.
But I really think rehab is a key part of it.
Yes.
If they walk your dog every day.
Yeah.
Underwater treadmill is amazing. And I don't find like laser. I know there's not much point in electro because I'm like really adamant and trained as Dr. Shu in my internship. I know it's DM. But I agree. I find like boxes are like freaking fast.
Yeah.
German Shepherds, and then the Corgis last forever.
Yeah, and then the Fox Terriers. I'm going to be here forever. You don't see Fox Terriers? The German Shepherd that we had the longest DM, and they owned the big hotel downtown, so they had more money than God. But her diaphragm got paralyzed. It was horrible. Seeing her struggle to breathe, and they got an O2 tank. I'm like, no, no. And we have her quad cart, which is used, so we appreciate it. But it definitely progressed to the diaphragm. Is a German Shepherd. Never. It will do it if they let them. Oh.
But do you see the GOLPP dogs? I see they're true GOLPP dogs that they're kind of we just respond similarly to DM and like really be an autoimmune component to it.
I'm sure there is, and DM is a cousin of ALS. They're studying it quite a bit with ALS. So I had a client come in and her husband's got ALS. I've had a couple. I'm like, whoa, that's so bad. Huh?
Yeah, what's in their environment?
What is in their environment? What's in our environment? Yes, oh, you're such a sweetheart. Okay, any other, huh?
Naltrexone, have you familiar with low-dose naltrexone for those cases?
I haven't tried that. How about you, Jeff?
It didn't work.
It did.
Well, it seems like it's more helpful for pain, like a recalcitrant IV the naltrexone in my hands when I used it.
Yes, Beth?
Anybody use mushrooms, lion mane on that?
Yes.
And? No, okay.
And antioxidants.
Well, are they seeing more cases of DM plus laryngeal paralysis? I'm wondering if other people are seeing that.
Yes. Weakness in the back end with the.
So,
Have they done the DM? Has anybody checked the DM?
what was the initials? G?
It used to be called laryngeal paralysis,
Then
but now
polyneuropathy.
Ah,
I should do an addendum. I will say that I have had a little bit maybe of an improvement and maybe having it holding cases static, using a and I don't know what one it is because I got so much crap going on because usually they're also a little dementia, right? But I'll use a product by Third Planet. It's only made by a company called Baduco in California. They do it's called it's like postmenopause. Microrev Neuro, and it's got lion's mane, and then lion's mane uses from Namex, which is of superior quality. They have turmeric, a little bit of bovine brain, and then a little bit of buckwheat. And I think the bovine brain drives it up to the head, and then the turmeric also anti-inflammatory. In some cases, I'll use that, and I'll add extra lion's mane, and I'll add neurotrophin PMD from Standard Process.
I use neurotrophin, yeah.
I think that's helping a little bit, but it's like, to me, I'm like, it's not better, it's not working. But I think staving it off and holding it,
Yes.
you need to accept that as a success.
If we can keep them stable,
Correct, correct.
we've done a good job with this.
Correct.
You know, compared to the alternative, which is euthanasia.
So
You know?
I think the lion's mane combo with that, and maybe additional lion's mane if you need to, is gonna help with the cognitive dysfunction. And maybe it's helping a little with the lower part, but, I mean, isolated for my disc dogs and anything, I'm like, that's not something I'm gonna throw my client's money out.
But Madeline, you gotta get rid of the inflammatory products in the spine first, before you're asking the nerve to grow back.
Right.
So anyone wanting to use lion's mane, you gotta make sure that that tight, fast pulse is going, that all the heat toxins are out of the spine. And then you go with lion's mane and ask it to come back. Because if you're asking the nerve to regrow when it's inflamed, you're just gonna make it worse.
Good point, Cynthia, thank you. Yes,
Based on, I missed Steve Marston's lecture this time, and I'm told that he talked a lot about improving blood flow, so I definitely have added the Beamer spot, the local piece for the treatment to up and down the spine. I try to get the client to rent it and use that on a regular basis. We send home a rental laser and have them do it daily, based on his discussion from years ago, and the double fluorum.
Okay.
So I mean, I have gotten some corgis that are like 6 and 8 years out, and maybe that's just what corgis do, but I feel like we made a difference in lengthening
oh, definitely.
keeping them on their feet
Yes.
with those processes.
Catherine?
Steve Marsden talked a little bit in his lecture the other day about DM. He actually has a new herbal formula called DM which apparently is brand new. Studies so far look really promising. So his whole lecture about DM was trying in any type of acute spinal cord injury was trying to lower the levels of nitric oxide.
Right.
So this formula is geared to that. So it should be interesting to see.
And Steve's company, he sells at Gold Standard? Natural Path, okay. Gold Standard for DM. I may get that and just check it out. I mean, we're all in the same boat. We're sharing information, yes?
Have you ever tried years ago Roger Clemens out of Florida?
Yes.
And I never had success.
Never had success. Roger Clemens was at UF. We'll forgive him. Huh?
Talk about somebody on the spectrum.
Oh, definitely, Roger was on the spectrum. And he had a whole protocol. And it was for anti-inflammatory, to reduce cord, antioxidants and all that. I never had good success with that.
He actually said
Right, right. And he also, does he still teach with Chi? Yeah, Roger.
Took acupuncture to learn to help DMs.
Yeah.
I was very, very frustrated with it. He's brilliant.
And a lot of neurologists do acupuncture. And it's cool because then they give us the information of how it works, which is awesome. So, you know, anesthesiologists, neurologists are the big, Aaron and a couple of the oncologists are all acupuncturists, herbalists, which are great for
I
us.
think the one thing that Roger did say is vitamin E slows the degeneration of myelin on the DM dogs.
Okay,
So
vitamin
take
E.
Vitamin E twice a day.
And you know, I heard in a lecture, and I'm like, oh, you know how you get that vitamin D? We're missing this. So I went over to check the vitamin D test and vitamin D. I'm like, I know that I've been deficient and I take it. And studies, breast cancer women have very low vitamin D levels. And it's not D2, it's D3. Also in Israel, the bad COVID people all had very low vitamin D. Vitamin D, and especially dark people, we do not absorb it from the sun at all. So I'm out in the sun all the time, and like my vitamin D was here. I'm like, it's like we don't absorb it. So you have to take it. And how important it is, and dogs do not absorb it from the sun at all. It's all in their food, and on their dry dog food, right?
Well, regarding vitamin D,
Time's up for
Okay.
the class, but you're welcome to stay and answer questions, but for anybody who needs a break.
Yeah.
Take a break from 10 to 10:15, but
Get your luggage, put it in here.